Hello, everybody. Good morning, good afternoon, good evening, wherever you are on your screen. And we are complete again, the four of us. Our envisioning and charming expert, Christy Tupper, which we warm welcome already. Before I open the floor for her, I'm grateful that my two friends are back with me. Feeling lonesome last time and using the opportunity and having a convo in German. Well, that was quite nice, did develop nicely, and it was inspiring me on going back to one of the topics which was not simply ROI related or the challenges which people have with software, but also with safety of data. And safety of data, especially when it comes to healthcare data, we have with Christy a very knowledgeable female expert aboard. Now, meet Christy Tupper, a passionate executive leader, renowned for cultivating high-performance teams that swiftly bring quality products to market, propelling business growth across diverse healthcare IT sectors. With a solid background spanning payer, provider, member, transactional, and biomedical technology, Christy is a trusted problem solver and strategic advisor, adapting at navigating complex challenges and client escalations. Believing in the power of team development, Christy fosters an environment of innovation and risk mitigation while prioritizing ROI, there we were, for clients and the business. With an unwavering commitment to meeting human needs, which is very important to me as well, Christy continuously evolves and improves products to thrive in an ever-changing market landscape. We've had Christy already for more than 3 times in our nice little combo in different roles and topics to our CM conversation, and now would like to talk with her as an empathic and knowledgeable expert on keeping health data safe. Is it possible at all? Welcome, Christy.
Well, thank
What
you.
did I forget?
Now, yeah, so I knew I should have chopped that intro down when I was reading. How do you crawl under your...
Well, we love to write novels.
I'm glad you guys invited me back. I like talking to you guys.
That is a very fair statement, and I'm very happy that you said so. Same is on our side, as we like the enthusiasm you always carry along with a broad smile and with some, the Germans would say, the Schalk im Nacken, that you have your humor also with a board. Yeah. But the combination of heart, brains, and the passion, that is a really cool one. Yeah.
Marshall, are you speaking German yet? Have you figured that out?
Nein.
Du lieber Gott.
This was one of his 2 German words. The other one is beer.
But your statement was fine. Du lieber Gott. Yeah.
I have a German grandmother. Had a German grandmother. Trust me, I heard that.
That is an advantage in this case. Yeah. So I would like to kick it off. What brought you to this industry at all, Christy?
A mistake.
Okay, that is also honest. You made a lot out of it.
Well,
You asked me what brought me in. You didn't ask me what kept me. But, no, I was right out of college, and I was looking for a way to break in. I wanted to work at EDS. I don't know if you guys remember EDS, the old Ross Pro company.
Yeah.
And they were huge in healthcare. So a couple years in, I got my break to go work in the healthcare sector in products, in commercial products. And I fell in love with it because you feel like you're doing something good for people every day, especially when I got later on in my career and we started, the data thing started to expand, not to date myself or anything, but as we started to get more and more into data collection and data hubs and data lakes and knowing the data you have and the insights you can derive from it, all of a sudden it was like, oh, wait, I can actually make people's lives better. That's why I'm here.
And does it?
I'm hoping that everything we do every day is in some way making somebody's life better, right? Otherwise, I need to do something different.
Isn't that the job of the doctors or the healthcare providers, as they are called here?
Yeah, but they can only do so much, right? If you can give doctors insight into the patient's risk and whether or not they've been taking their medication, regardless of what they tell you, the doctors can be armed with so much more information about the actual patient and their condition and what the next risk might be, or, especially for people, there are 4 risk stratification categories. And for the people who are on the higher end of that chronically ill, catastrophically ill, I mean, you definitely can give them enough information to help them treat better.
Well, we should ask
ignore the typo. He already apologized for it, but
what is your favorite song?
What is my favorite song? Brent, my favorite song is Purple Rain.
That
should have been Prince in the halftime show, by the way.
Exactly the right answer for Brent. So, looking at the industry here, basically American focused for time being. I know that Ralph is also interested in the German aspects. How is healthcare organized in the US? I mean, I'm here for only 3.5 years. I haven't figured it out yet.
I think you mean, how is it disorganized? They're trying. They've been trying for a long time, right? Some of the things that they put in place, they being the government, have helped, right? They've done things like standard transactions to exchange healthcare data. Companies are coming out with what they call EMRs for electronic medical record keeping. So, I don't know if you guys ever use, there's an app that you can get on your phone called MyChart, and you can see across different providers. Like I live in Connecticut, so I have Hartford Healthcare, Yale New Haven Health, CVS, all of those providers that happen to use the Epic EMR system that connects to MyChart. It's great. I can see all my information in one place. However, not every provider uses it,
this is a problem that I run into.
Which is a problem they should solve fast.
You would think that it wouldn't be that difficult, but I'm sure there are people a lot smarter and more experienced than me that could tell you why it is that difficult. You've got all the data. You've got all the data passing back and forth in basically standard transactions. HIPAA sets, the X series of transactions. There are FHIR transactions. There are all kinds of things that go back and forth. There's really no reason that we shouldn't be able to corral all of that and put all of that information in one place, so I can see not just what I have done at those places, but if I go to a specialist.
And the other specialist that gets the referral probably has a chance to see it as well, before I bring in the paper file, so that specialists can inform themselves.
That would be really nice. I think one of the most frustrating things for me is I religiously keep my chart up to date. If I get a new med, I make sure it's in there. If I stop taking something, I make sure I take it out of my medical record. And then I have to walk into a provider's office who's not on Epic and list all of my medications. And invariably, to make a point, I will say, hold on, let me look at my chart and I'll let you know what that is.
And now imagine that you are in good old Germany and you are at the top of the wave and having at least a so-called patient card, but which is still kept quite stupid, or to take it positively, very secure. Yeah, because it has nothing on it, just the core data as your name, your birth date, and some core information, which will go for a change. But there is nothing what another doctor, for instance, could utilize in a smart way, such as I know all the former diseases. I know a lot about where he is allergic on, so I don't give him, for instance, an injection where he could throw away or get very nervous. Yeah, all these. And I thought that this would be one opportunity. So being at the dentist today, I was quite positively flashed. They utilize in every patient's room or where they do their job, they have 3 screens. They have your radiologic informations on screen. They do the diagnosis together with you on screen and no longer on something they use formerly in these flattery things they put on a light.
X-ray film.
Yeah, X-ray film. Thank you very much, Marshall. I still know how to spell fax, but X-ray film, yeah, well.
No. Don't worry about it. We understood what you were saying. I just interrupted.
Digital photos even arrived at the doctors.
Yeah.
Honest. And they have now something which I found positively flashing, such as she got me into an X-ray. I had a full head screen to get a proper documentation. And 5 minutes after I went out of the X-ray, the doctor was already analyzing everything, showing me the data and giving me a proper diagnosis, which was, put it politely, costly.
Well, it's dentistry. There is no cheap dentistry.
No.
And again, Thomas, what did you say?
You should have brushed your teeth a little better. Okay, just kidding.
Well, if
that's
I
what the doctors usually say. Brush and floss is what they say, right?
Yeah. And go for somewhere where it's a lot warmer and below. Yeah, that would be have been my answers, such as hell is where you could have a lot of advisory for such folks like you. But I was so honest to confess that I have had nearly 35 years ago a real investment in my dental care. This was at that time absolutely innovative team of doctors which were committed to do the most innovative stuff. Same at that time, not yet my wife, but my fiancée already did at another place with the same team of doctors in this community. And this saved us for over 30 years expensive stuff. But now it's like warranty has gone, my friend. And TBF time is reached. Now your bridge is gone and pay the bill, baby. Now, I come to the point that I would love to learn a bit about not only how the EMR or the patient data is recorded and kept safe and how one can save in a smart app to buy at the right place the proper medication and what he has received for medication, but also what is just striving it, like the tip of the iceberg, the general approach in how health insurance is managed. Because here in Germany, you have, let's say, an institutional system which is, put it politely, very basic. My dear friend Thomas has other words for it. And you have a private insurance system. And even that I do not live in the US and I do not understand a thing about what is the helping thing on Obamacare, is how this is done in the US. Now they are tipping me that I'm losing track. Okay.
No,
you
you're
are telling fairy tales, which is nice.
Okay. back from the fairy tales to the hard words life, such as what is the system and how is utilizing the system in the States? Where are the differences there towards, for instance, Europe?
I don't know European healthcare. I've never been involved in it in any way other than general discussions. In the U.S., in the U.S., it's basically, and there are self-insured people out there. There are people who form their own alliances and create their own basic insurance companies, right? But mostly you have a system of health insurance companies. If you work for somebody, generally your employer provides the insurance coverage for you and contributes a certain amount of money to it. And then and you use that as your coverage. You could, if you work and your husband works, you could have what's called coordination of benefits. So you can use his benefits and you can use yours. Your kids will benefit from that. You will benefit from that. But generally, it's all health insurance company driven.
And how do they keep the data?
How do they keep the data? I mean, there are really strict data protocols, just like there is in any other industry, like finance, right? There are standards like the HIPAA standard, which was 1996, I think, the Health Insurance Portability and Accountability Act. And that's the standard, basically, that is like ground level. Like that's the basic compliance, right? So every year, if you work in the healthcare industry, especially on an IT side, you're going to go through HIPAA training every year to make sure that you remember that from an IT perspective, you have a certain relationship with that data, and it's your responsibility not to disclose it, not to use it when you don't need to, right? It's, a minimum necessary standard. And so, for instance, I don't really need to see somebody's claim data at this stage in my career. The people who do the hard work are the people who have to look at that to understand how the data is interacting with the system. I don't have access to those systems. I don't need access to those systems. If I do, then I will, I'll go ahead and get it for a limited period of time to see whatever I need to see. And then I'll have it taken away again because I don't need that to do my daily job.
So are the controls on healthcare data more about privacy, or is there a real security issue involved with them as well?
I think it's both. I mean, I think there's definitely the HIPAA privacy. No one should be able to see your data.
Privacy is in the name of that act, the Health Insurance Privacy and Accountability Act.
Right.
For those of y'all who don't know.
If it's a security concern, the concern with that security, more than anything, is the privacy, right? Like if there's a breach in a system somewhere in a healthcare provider, nobody's too awful concerned about a financial side of it because most of it goes through insurance. What they are concerned about is the privacy aspect, right? Nobody wants, and Mary doesn't want everybody to know that she was diagnosed with cancer or has a disease that, would call her personality into question or whatever. People worry about those things.
Okay, so there's regular training, but how is that enforced in general? I mean, we have, let's take the aviation industry as another example. There's the FAA, which has protocols in place and, does some regular checking or not. How does that work in the healthcare industry?
Well, so in the on the IT side, you need to be certified, HIPAA certified, right? And you go through audits. I think we are, the company I work for now we have all kinds of certifications, ISO 9001 certifications, high trust certifications, whatever you need to be able to do business. And they check the security, and that's what they're looking for. It's to make sure that your transactions are secure so no one gets that health data information.
Okay, so now that's the transactions themselves in specific, but in general, how about the systems? We are hearing more and more about, for example, ransomware attacks where whole systems get encrypted. So that could spell disaster for a digitalized hospital, for example.
Absolutely. And, one of the things I never thought of until the last company I worked for before this one was how that impacts assets in an operating room, for example. If you are under anesthesia and you have a robotic arm that is doing surgery on you and that gets hacked.
Well, you at least don't feel.
There are companies that specialize, like the last one I worked for, that specialize in keeping that equipment safe and the cybersecurity protocols to make sure that doesn't happen. Your data being stolen is one thing, but somebody interfering with your surgical procedure is definitely another.
You're playing with people's lives there.
Literally.
It's not. It is taking people's life at harm. And Thomas is on the spot. The General Hospital in Frankfurt has been shot back to Stone Age. They have been hacked, and now they are back to paper. And everything which was automated in operation arenas, not during the attack, but they were to that point safe and sound. So no robots on work, which were cut off. But it's like you are back in the 50s or the 40s in that hospital these days. So they can only do a third of the workload they were used to do. And it's like what Thomas said was they are running around with paper files. No joke.
Yeah, I mean, it worked for a long time, right?
Yeah.
With reward comes risk. With risk comes reward.
Ouch. Yeah.
Yeah. Still, there's quite a big risk in general. Also, I mean, I can imagine also it's getting back to patient data. It's themselves or itself. I can imagine that there are lots of actors, lots with a capital L, who would be interested in that just for, well, let's take nefarious purposes as marketing some Viagra to the old guy that I am. Sorry for the V word, but and trying to get into
that I was having trouble with.
Well, I'm told it's tiny and blue. So
the pill, yes.
I wouldn't know. Yeah, I wouldn't know. So, how do we take care of that? It's not only how is that secured? Are there any regulations around that as well? Is that covered by HIPAA or any other regulations?
And additionally, how come these things where you have your fitness data, real life, which doctors would like to analyze as well, and how are they secured?
Yeah, they're secured by however you set them on your, I've got an Apple Watch and it's secured based on whatever I set it to on my phone.
Okay.
And if only I could share that data with my doctor. I would love to share the EKG data already on my phone.
Yeah.
I would love to share the amount of water I drink and the nutrition stats from logging my food. And as of yet, I don't know of a way to do that.
I'm quite sure it's shared with your insurer to adjust your rates. So how would
theoretically, they're not supposed to be able to do that.
Yeah, but there's that word, theoretically.
What are the main players? So we have the insurers, we have some tech vendors, we have the healthcare providers. Of course, we have a regulating body, and whom am I missing?
The patient.
That needs. Good point.
Good laws.
Who thinks about the customers these days?
Right.
That's right.
I mean, it's a patient if you're a doctor or a provider, right? It's a member if you're a health insurance company, but it's all that same person's that walks into the office.
Who else is in there, and what data do they need? We already established that there's quite a strict protocol for exchanging it that sometimes is used and sometimes not. But
there are a lot of tech vendors in the middle there when it comes to exchanging the data and collecting and analyzing and reaping the data. there are companies out there, and I have a very good friend who works for one of them, that they bring data from different sources together and synthesize it, which is like, yes, please do that. I mean, the reason that I really got excited about healthcare data was when I started working for Genea, which unfortunately is no longer in business. One of the things that they wanted to do was collect all of the data around a patient and allow the patient's care team, so that could be the dermatologist, the cardiologist, the primary care doctor, the oncologist, and the patient's primary caregivers, maybe daughter, maybe son, maybe husband, maybe wife, to all communicate in one stream to say, hey, hey, primary care, when we came back from the doctor, they had given us this. Is that okay? And that was, I mean, once you start to use all of the data that you have to form insights and drive insights that can help to predict or help people manage a patient's care and give you an overall 360-degree view of that patient, that's the gold in the industry from all of those players.
You said one of the magic phrases, 360-degree view. So that makes me need to ask, where does CRM and customer experience technology fit into the healthcare ecosystem?
It fits actually it fits in, probably I can make it fit in 4 places, but primarily it fits in 2. And if you look at the triple aim that was then expanded to be the quadruple aim in healthcare, it starts to make sense. One of the tenets of the triple aim, which was the original standard set out, was to improve the patient experience.
Right.
When they expanded it to be the quadruple aim, they started to include provider experience and provider balance, because provider burnout is a real thing. And you would not believe how many doctors every year commit suicide. So they expanded that to be a quadruple and also focus on provider experience. So those 2 are the direct links to healthcare.
How do they define a good experience to the 4 stakeholders that I now understand out there?
I mean, from my perspective, as a patient, as a member, it's outcomes, right? Improving the population health overall is one of those tenets of the quadruple aim, but it's improving outcomes. If you can use, I know everybody is very careful with their data, and I am careful with my data to an extent as well. But here's the thing. If I can give my health data to the people I trust to have it, and they can look at it and say, oh, you're trending up here, you're trending down here, which is something we wouldn't have expected. Oh, and by the way, you added this medication. This puts you at a greater risk for stroke. Okay, let's talk. You can have whatever data of mine you need in order to help me prevent that in the future. My mother had a series of strokes and eventually died from a stroke. Yes, please. Here's all my data.
You used one keyword there, starting with T and ending with a T.
Right.
How to determine who is worth of your trust?
If your doctor isn't worthy of your trust, you need to find another doctor.
That's fair, fair enough. Okay, but this is only one party that is involved, right? So, and you are not running around with a big paper file.
Well, I mean, any of your doctors, right? You have the ability in the US to choose what doctor you go to. So find a care team you can trust.
Yeah. Luckily, we are not in Great Britain, where you have the NHS. You have no free choice. You have to go where they tell you. Same in the Netherlands. And so we have also the free choice of the doctor, but we have a limited number. So we have only in cities enough doctors we can choose of. In the more landscape or scenic areas, it's already getting for primary doctors, such as the doctor you had around the corner is no longer there.
Yeah, but that's kind of a business reason. The reason is they don't see enough patients, so they go bankrupt. Means the old stuff, they don't find a successor. So that's it's not like the system prohibits it. It's probably the same here, right? I understand if so many of those doctors are.
It's competition too, right?
Yeah.
If you're part of a healthcare system, I'll use, for example, Yale New Haven Healthcare, right? If you've got that in your area and you've got a small doc in your area, that every time he refers you, he has to refer you to somewhere to get a CAT scan, somewhere to get an MRI, somewhere to get an X-ray. He's referring you to those places anyway. It almost makes sense for him to become a part of that system. And you have to remember too that not seeing enough patients is a lot of times imposed by the health insurance companies. Like, what should your productivity rate be as a doctor for us to give you a profitable contract with our health system and with our insurance company? Insurance companies have networks and rates for all their providers.
There you go.
Which is true, and right or wrong, can't justify that. Which also to some extent negates the statement that you had before, right? You have free choice of the doctor, which you haven't. If you're affiliated with,
you can still choose your doctor. Your doctor that you love may just be now associated with the healthcare system. Yeah, that's the way it seems to be.
Okay, so the consequence then is you go out of pocket,
or the data doesn't get shared, which is what my issue is. I have a whole bunch of doctors. All of them are in a system, except for my primary care doctor.
Oh,
it's maddening.
Right.
Because whatever I do with her does not get back to the others. And whatever I do with them, they need to give her special access to my data so they can coordinate.
And that's often the worst part. And I remember when my mom was sick for probably about 2 years. And I've told this story, so you guys have heard this, stop me. But I can remember I would take her to her primary care doctor, and her primary care doctor would set all of her meds. And then the next day I would take her to her dermatologist, and her dermatologist would say, wow, your Coumadin is really high. We should cut that back. And he'd cut back her Coumadin, and I'd go back to the drugstore and get the new prescription and dump out her pill case and refill her pill case. And then we'd 2 days later go to the cardiologist, and the cardiologist would say, wow, your Coumadin level's pretty low. Your vitamin K is probably off a little bit. Let's adjust that. We'd dump out her pill box, and I would go back. Like, that kind of madness needs to stop, because it felt to me, I was the only person and a friend of mine that were giving care to my mom consistently across all of these doctors, and we couldn't keep up. Like, gosh, guys, please talk to one another. And if I would take her back to her primary care, and I'd give him the current med list, and he'd say, whoa, what happened here? What do you mean? You don't know? It was even so bad. She had an appointment with that doctor on a Monday afternoon. I got a call on Tuesday morning saying your mom missed her appointment on Monday. I'm sorry, you weren't aware she passed away on Sunday night?
Oops.
Geez, you'd think that would be data that somebody would share, right?
Yeah, that's something you would want to get back to your doctor.
Isn't that a case for central storage of all healthcare data?
Or at the very least, interoperability.
Yeah, or if somebody has passed away, that they get an information.
Right.
Because the same thing what you just described happened with my dad a day after my mom has passed away. Yeah? And they were in the same hospital, but in a different department.
How does that happen?
Yeah.
Right. How does your primary care marshal not know what all of these other doctors are doing to you, for you, with you? Like, you look at that primary care, at least in the US, and like I said, I don't know European or any other systems, but in the US, you look at that primary care physician as the one person who's got their arms around it all. Thank God somebody does, but they don't.
Yeah.
So no, you said there are interoperability systems, as evidenced by this MyChart application, which I didn't know before, by the way. So
Learning.
if not everybody is using the back end of it, as physicians, healthcare providers, insurers, whoever's involved there, what can be done to incentivize that? Because this is probably from a patient / end customer, consumer point of view, the right thing to do. What's
Yeah, it's the right thing to do. It's expensive. It's expensive. A lot of these healthcare providers, whether it's pharmacies or hospitals or whatever, are still running on systems coded in COBOL.
There's high tech in Germany. Believe me.
Good old COBOL.
It's
Makes it
expensive to upgrade your systems to something that will be interoperable. But
okay, so basically they don't have interfaces.
Right. Sure. I'm sure that's some of it. I'm sure some of it is resistance to change. It all comes down to, gosh, guys, please put the patient's care first. And not necessarily the doctors, right? How can we help them? How can we help fund those things?
At the end of the day, isn't the interoperation far more expensive? I mean, just yesterday did some stats. So a whopping 17+% of the US GDP, gross domestic product GDP, is going into the healthcare sector. This is serious money. Looking at how big the GDP in this country is.
And that's without putting a value on lives.
And
is there value on lives here? Okay, kidding.
The aspect that I had some context to insist is they showed me their systems, and they had some connecting, ordering capabilities and go through interfaces, such as large hospitals have logistic connections to centralized distributors. But from that on, there is no further connection, such as if you need a medication which is allowed but not available in Germany, and you have to source it from outside Germany. Yeah, there is a break and a gap. Yeah, so and I do not see that the doctor has a direct connection to 3 or 4 pharmacies around 5 to 6 kilometers, who can tell you by giving you the prescription, if you go to that pharmacy, they have it on stock. If you go there, they can order it in 2 hours. Something like that, that would be valuable for me as a patient. And I would know that they know about each other and that they exchange data regularly in a safe way. That would build my trust. Yeah.
Sure. Absolutely.
Well, back to those 17%. So what drives this so much? I mean, the common opinion is whenever I talk to someone about healthcare in the US, it sucks big time. So at the same time, everybody complains it's probably the most expensive worldwide too. So somehow that doesn't jibe. So what do you think can be done to make this more pleasant for everybody, except the ones who collect the money, because they probably will suffer if it's getting cheaper?
Yeah, I mean, as soon as it becomes a commercial enterprise.
But still.
One of the things that you have to look at too in the US right now is a lot of healthcare companies are being bought by insurers. And
that seems monopolistic.
Okay, that's better than incestuous, which was where I was going, but yeah.
But exactly in that row, Christy, such as I own 5 companies and if you prescribe for something like against headaches, aspirin, or God knows what, Tylenol, you have to use first my prescribed, my owned companies, dear doctor, or I will not give you an appointment if I can enforce that. Yeah.
And some of those costs that you're talking about are also driven by, there was a time when you went into the hospital, like when I had my kids, I went into the hospital and I had both of my boys via C-section. And after it was all said and done, I got one bill. Now, it was a very large number at the bottom of that bill because I was in the OR and I had anesthesia, or well, in one case I had anesthesia, but that number is pretty big, right? Today, you don't get one bill. Today, you get a facility bill, you get a doctor bill, you get an anesthesiologist bill, you get a surgeon's bill, you get a bill from the hospital for the medications that you used, right? It's kind of crazy because you lose track of just how much that encounter cost you.
Yeah. And
probably on purpose.
And question on that one, did you pre-operative, did you get an offer? Did you have to sign that offer?
So
and did you know that you get afterwards 10 bills?
And that's actually getting better. So, for example, in my chart, if I am going to go have a procedure done, I can look in my chart for the doctor that's going to do it and the insurance I have. How much will this cost me at the end? So the transparency, that is the one thing that I think is starting to get better in the US, is the transparency. And for as awful as that one big, or for as beneficial as that one big bill was, because you only had one bill and you could look at the bottom line, you also don't have quite as much transparency into what each one of those line items, claim lines is, right? So one of the things, and I know the company that I work for now, we're driving, is transparency. And everybody deserves to know what's going on around them as far as their healthcare goes.
Exactly. And that is something which, as a private patient, not the standard patient in the standard insurance, but as a private patient, they are obliged to give you a clear, explanatory, step-by-step invoice, which is pages of explanations, or you get it on the backside, but they explain at least why they charge you the double or the triple of the standard patient. Yeah, it's like a magnet to your money. Yeah, if you are a private patient, and it is exactly what you said. The insurance company justify how much they are willing to pay to a doctor for a certain activity, and they only make their money out of the business model. They charge the private patient, who should have more money, the triple or even at least the double what they charge the standard patient. Both have the challenge that they do not know how their data is transported, how it is, let's say, accumulated in a community data center for doctors, and how safe the data is there. How is that handled in the US? Against of all these nice little abbreviations where we, if we would like to trust, may trust. HIPAA, GDPR, God knows what. But at the end of the day, how trustworthy is it? How reliable is it?
How trustworthy and reliable is what? Where the data is collected and stored?
Yeah, and the protocols.
I mean, I think in something like healthcare, it's probably a little more safe than just, having apps on my phone and, whatever password I choose and keeping my password in the password manager and whatever. It's definitely safer than that. I mean, you have to meet standards to transact in the data.
Yeah.
So every hospital has an IT department now.
Is the financial data handled differently, or does that fall under the same act? We were talking about invoices before, which raised the memory in my eyes as well.
I don't have a whole lot of insight into that. That's a really good question. I assume that data falls under the financial data standards, and maybe even also the HIPAA data standards, because no matter what that financial data is, that claim line is very specific with a procedure code, a diagnosis code, maybe, right? So all of that is PHI information. Even on the financial side, you're going to see the PHI information.
PHI, personal health information?
Protected health information,
Okay, so protected health. So similar to PII, yeah? So
it is similar to PII, yes.
Oh, probably even more sensitive.
Right. The H makes it more sensitive.
That makes me wonder how they manage this data and exchange this data. So now, fairy tale from my end. In beginning of December 21, I had a treatment. The invoice came shortly after, of course. It also was paid shortly after. So there is, via clearing through the insurance. So since early summer last year, so 23, I get probably monthly a letter that there's an open balance. After I talked to them a couple of times, so this is the date of the procedure, this was the date of the invoice, this is the number of the check, and this was the date it was cleared. How comes they don't know that?
I don't know. The same reason I can't convince my insurance company that I haven't had secondary insurance for a year and a half. I've called them 12 times. Not lying. I'm not exaggerating.
That's been the doctor, not the insurance, right? So
no, it's the insurance company.
No, the invoice comes from the doctor.
Oh, your invoice comes from the doctor.
Yeah, my invoice comes from the doctor.
Somebody needs to get the memo.
Ouch!
I bet it's being walked over to their office right now.
Even the sale has been overtaken. Yeah.
So again, back to this time end customer experience. What do you suggest? I mean, you're an end customer there as well. You're an affected person and involved in your case. What should happen in your eyes to improve that situation?
Which situation?
Well, the situation that experience, not only costs suck, but the experience sucks as well. Oh, sorry. The experience is bad as well. Probably not from a making an appointment point of view, which sometimes is difficult as well, but is from a treatment point of view, from the referred to doctor knowing enough about the referral, up to the invoicing processes.
If I had that
take your choice.
If I had that answer in the 12 minutes we have left, I would be a very rich lady, and there would be a lot of differences being made as we speak, right? But I think if you look at the customer's priorities, so as a patient, what is my top priority?
Stay the heck out of hospital.
What is it?
Stay the heck away from the doctor.
Staying out of the hospital and staying out of the doctor's office, right?
Yeah, stay healthy. Yeah.
So whatever you have to do to make sure that I stay healthy, that's what's important to me. The financial concern and the insurance concern, they will resolve themselves. If I don't have to go to the doctor or the hospital, I'm not going to need that insurance. I'm not going to need to pay a bill. So overall, population health, the improvement of population health overall is the key to improving everybody's experience with the healthcare system. And we can do that with predictive analytics. We have all the data. We just need to synthesize it and derive the insights.
So now who would be in charge of synthesizing and providing the analytics?
Lots of companies do that. Lots of companies. There's a company called Validic that gathers data and synthesizes it from a healthcare perspective. At Genea, we did that with claim data, right? We're doing it today in the company that I work for today with pharmacy claim data, right? And pulling that into business intelligence to see what kind of insights we use to drive better outcomes and better experiences for the pharmacies and the pharmacy benefit management companies and the healthcare industry and the ultimately the patient.
And what data gets synthesized there? Because you just said, for example, claim that you use claim data, and claim data does not, well, from a pharmacy level, does not include the diagnosis, or at least not only the high level. It includes what is there to treat whatever it is.
Right. And so again, I don't need to have that information. So I have to admit that I haven't seen an actual pharmacy claim come through. So shame on me. I have not looked at that. I know on a healthcare claim, all of that information is present. I know on a pharmacy claim, right? It's the NDC code for the drug. It's what is the drug being prescribed for? It's the person's name. It's the person's health insurance company number. But I can also tell how many times they're refilling it and how fast they're refilling it. And if I get the data from all the pharmacies, not just CVS, not just Walgreens, but all the pharmacies, I can see when somebody's getting an opioid prescription filled at CVS on a Monday, Walgreens the following Tuesday, an independent pharmacy the following Wednesday, and in turn, in a cycle of 4 weeks where they're supposed to get one refill, they've gotten 6.
Yeah, then it's probably not medication. Yeah.
Well, or it's this person has a problem. Let's treat the problem, because the opioids are probably no longer either helping for the pain or for, because now it's become a dependency.
Yeah.
And that person, if we can keep that person controlled and out of the hospital, their life is better, the cost is better, everything is better for everybody, right?
I suppose there's also the concern that that patient might be running a secondary job with collecting and redistributing narcotics.
Right, which is also a population health issue.
Yeah.
Right?
Just somebody else, it's just somebody else.
Fentanyl, and then somebody dies.
Yeah.
So with all this data flying around, is there a place for artificial intelligence
Absolutely
to help sort it?
Absolutely. Interesting though, I just saw an article this morning, and I didn't have an opportunity to read all the way through it, about CMS for Medicare Advantage limiting the amount of AI that you can use in making medical decisions. And I have to go back and read that. I just saw that hit this morning, but very interesting. I mean, if you can use AI and machine learning to predict when somebody's risk of readmission increases and they're going to go back in the hospital, that's a win for everybody. If you can use AI to predict that the lack of a medication adherence problem, or the lack of medication adherence is going to cause a risk for readmission somewhere down the line, and these people are non-compliant, that's going to help everybody.
Cool.
Who owns this data, by the way?
Define own.
Well, we own like in ownership.
You're a steward. I mean, the technology companies are a steward of the data, but ultimately it's your data. You can walk into any doctor's office in the US and say, I want a copy of my record, and they have to provide it.
What's the stance of the insurers?
They are users of the data to process a claim and pay it.
That's the legal stance, or the legal position. So they're users, but
that data
is theoretically
that data
is That's the legal position here too. I'm just asking. I frankly don't know. I think
so. I mean, I would have to. I can go back and check myself on that, but I think that's correct.
Just thinking of all the marketing stuff that I get for whatever other reason. So this everything but healthcare related. So every company that markets says they own the data. And that's why it's just a transition to asking myself how that is treated in this line of business. It's
a good question, and I did not do any research into that. It's a good question.
So we opened up the trap and you fell in, yeah?
I'm not doing that research. I'm sorry.
Oh, and here I thought we'd open the door for yet another time to have you come back.
I will always come back when you guys ask. You know that.
Next time on CRM Evangelist.
So, last, you said, so the best thing is data sharing. The best thing that could happen is data sharing and analyzing it for insight, so that one can act on this insight. So in order to that, famous last words, by the way, in order for that to happen, apparently it doesn't happen. So what needs to be broken up? What would be your vision of the perfect healthcare system that helps us staying healthy, also staying out of the doctor's rooms? Second, when we are in there, for whatever reason, it happens, right? It just needs to be an accident for whatever reason. Yeah, so it might be genetic as well. So once you're in there, that your experience is good. And third, after.
I have ADD. Can you repeat the first question?
Oh man, me mumbling around. So part one is, in a perfect world, how would a healthcare system be set up to avoid us getting in there? Second, once we are in there and in the system or processed through the system, the various stages, that this experience is good. And third, well, the after experience, the moment we wake up from the shock that the invoice creates us, that this works as well.
I think in a perfect world, we have an easy way to de-identify the data that goes into the data lakes that the analytics companies are using, right? That allows them to do more research with AI and machine learning, and gives them better tools to use than in practice on real non-de-identified data. To improve the patient experience, I think that was your second one. I think the best thing you can do to improve a patient's experience is to keep them out of the doctor's office. And if the doctor had all of the data in front of them, if your care team, if you aren't able to take care of yourself and your care team had all of the data in front of them and everybody could communicate openly, easily, freely, as easily as you and I text message one another, that can only benefit you as a patient. After the fact, there wouldn't need to be an after the fact if we do our job to keep people out of the hospital. But if you are in the hospital, transparency and an understanding.
That is a perfect 2 words, transparency and understanding. So somebody applauds that. And heart is coming before we had, by the way, someone who found it funny. So whoever that troll was. So thanks for being here, and let's Marshall take care of the outro today.
I can do that because it's been yet another wonderful time talking to Christy Tupper about healthcare issues. Always love having you here, and you know that we're going to do it again. So
awesome.
It's just a question. Thanks also to our guests, not our guests, our audience, who are also guests, if you think about it. Thank you for joining us. Next week, tune in when we dive into SAP's recent approach on AI and CX with our dear friend Nitin Bajatia. I hope we will have you there.
Thanks a lot, and
take care.
Cheers,
Take care.
everybody.